This last week, CentraCare doctors saw a big increase in a number of patients coming in with influenza. Now, influenza or the flu season typically starts in the early fall, and it just ramps up and gets worse until we get to our epidemic levels in January and February, and that's the seasonal pattern of influenza. During that time in January and February at peak levels, we may be seeing upwards of 600 or 700 cases a week of influenza. Last week, we saw 145 cases. Now, while that may not seem like a lot compared to the middle of the season, it is a fair amount compared to the same time last year. So last year in the fall, we were seeing about 60 or 70 cases a week. So right now, we've doubled the number that we saw last year. That may be a good indicator that we're going to have an early season, but with the flu, you just never know. It may get worse. It may die out. It's very hard to tell, but the warning is it's time to go get your flu shot. Who should get their flu shot is anybody that's over the age of 6 months old, basically. We, of course, target people at high risk of complications from the flu because, remember, 40,000 people die each year from influenza, so there can be complications, and it does happen. So the easiest way to prevent that is get your flu shot if you're at risk, and also get your flu shot if you're young and healthy, because you want to stay at work. You don't want to be out of work for 7 to 10 days with high fever and body aches and the serious infection that happens with influenza. Now, just to dispel some myths, the flu shot contains a dead virus, meaning that after you get your flu shot, you cannot get the flu, you will not get an infection, you will not get sick. At worst, you might have a little localized soreness at the injection sites.